I'm Steve Clemons. I'm director of the American Strategy Program at the New America Foundation. I'm with former Senate Majority Leader Tom Daschle, who's also co-chair of the Obama for President campaign. He's written what I consider to be one of the most important books out there, focusing on the nuts and bolts of America's healthcare challenge, called Critical. And I just wanted to give you a few moments to explain to us why you see in the pantheon of public policy challenges facing the country that this is by far one of the most critical for the country to get itself around.
Well, Steve, I'd begin by saying, of course, we're the only industrialized country that doesn't have a universal healthcare system. And because we don't have a universal system, we are experiencing extraordinary repercussions, cost repercussions, quality repercussions, access repercussions that become even more serious, not only for the typical American, but for business, for state government, for federal government entities, and really across the board. Our competitiveness is at stake as a result of our lack of ability to grapple effectively with the many challenges we face in our healthcare system today.
Now, you just told me a few minutes ago that you were with a pretty well-known CEO, we don't need to go who it was, but said that this problem was so huge for his firm, the rising costs, that his firm may not even be around in 7 years. Where is business in this debate today?
Well, this particular businessman said that they don't have 7 years. They have a couple of years before healthcare costs will drive them to close their doors forever. One of the oldest companies today in America, and I was really surprised to hear that dramatic state of affairs. My guess is that business is in a far different place today than they were 15 years ago, the last time we took up healthcare. I've even had businessmen come up and say, I'm willing to take the most radical thing you can think of doing because I don't think we can take it anymore. We've got to recognize that our system is broken, and unless we fix it soon, a lot of our companies are going to be broken too.
Your friend and former Senate colleague Kent Conrad was front page news this week with the size of the budget deficit that the country's facing this year, of course, in the Bush administration, but it's not a fun package for the next president of the United States to inherit. How do you make the case with Americans that when you look at the fiscal situation of the United States, that this investment in health care, because the price tag of the kind of universal coverage you like, and as I understand it, if you subsidize those who are least able to get it, you actually favor a mandate. But how do you sell that price tag to the American citizens given the lousy state of their fiscal situation?
Well, the only thing I can say is that ultimately the goal must be to reduce the cost. I would start by saying if we do nothing, healthcare costs for the typical American will double within the next 10 years. So if they think they're paying a lot now, and they're paying in taxes, premium, and out-of-pocket expenses about $8,000 per capita, we're going to see that double in 10 years if we do nothing. So no one should assume that if we do nothing, the situation is stabilized. It gets worse exponentially. So we start with that. And one of the key goals has to be to bring down the level of cost. The cost growth curve in this country is unacceptable. And that goal is going to be one of the first priorities of a meaningful healthcare reform effort.
I guess finally, when I was a staffer in the Senate, I used to see you encourage your colleagues to tackle big challenges and to move in. But there were some challenges that you did for political reasons or posture reasons. And I guess, the question I'd love to hear the most honest answer to is, given your experience and as honest as you can be, do you think this is really doable in the near term?
I think it's doable with two things. First, we need leadership. If we can't get leadership from the White House, the President, this will never happen. And secondly, we need bipartisanship. The President can't do it with his party alone, Republican or Democratic. It has to be both. We have to find common ground. We have to build the coalition in Congress politically and economically to make this happen.
Tom, I'm really honored you spent some time with us today.
My pleasure, Steve. Thank you.
Thank you.